While it may sound like the name of your grandmother's peppy friend from Bridge Club, CLABSI is an acronym that stands for Central Line Associated Bloodstream Infection, and it poses a serious threat to human health. There are multiple types of central lines. They may be inserted through different sites, both central or peripheral, but all of them are different from standard venous access devices in that their tip ends close to the heart or in one of the great blood vessels. Central line-associated bloodstream infections are defined as a laboratory-confirmed bloodstream infection in a patient that has had a central line in place for at least 2 consecutive days prior to confirmed infection and that cannot be related to an infection at another site in the body. There are a number of pathogens associated with causing CLABSI: gram-positive organisms, gram-negative organisms, and other species such as Candida, a fungus. Some of these species are part of the normal flora found in and on our bodies, but can cause infections when introduced to our bloodstream via opportunities such as central lines. Others listed are highly resistant to antibiotics, amplifying a growing threat to the field of medicine. Biofilms are one of the ways that central line associated bloodstream infections can happen. It's a major virulence factor of pathogens. Biofilms are aggregate colonies of bacteria that form in an extracellular polysaccharide matrix. It helps them communicate with each other, defend against antimicrobial therapy, and adhere to the surface of the central line. Biofilms are that slime layer you feel on your teeth when you haven't been brushed them in a while, or the one you see on your fish tank when it needs to be cleaned. Left untreated, they can lead to sepsis, septic shock, and even death. Healthcare workers should be vigilant in watching for signs and symptoms of infection and notifying providers so that appropriate intervention and treatment can be identified and initiated early. Sterile insertion, aseptic maintenance, surveillance, and management strategies can often prevent negative outcomes or prevent CLABSIs in the first place. While they are a serious threat, central lines are an integral part of healthcare with benefits that outweigh risks for many patients.